Well, thank you so much. Thanks, PMD Alliance, for hosting this. It's such an important topic. I'm just excited to be part of it and to kind of bring sort of the space, open the space for this important dialogue. I am a mom of 3 boys. I'm wearing some pink today, and I also run a VA Center of Excellence. So I don't really get to hang out with women so much as I would like to, but as a woman, I think that it's so important that we amplify the voices of women with Parkinson's. I think we have done a very good job of impacting the same types of folks that we've talked about time and time again, married, affluent men who are educated and that are white, largely. And I want to change that dialogue. So we're really excited to bring Richelle Flanagan, who has become a colleague and a friend and, an amazing advocate of women, who has just been amazing to align this second panel. There's a first panel that I'll refer you to that we will link here that already took place in the UK. And we're really just trying to bring together global voices to really think a little bit more deeply into, we know that the women's issues in Parkinson's are unmet, but how can we really dive deep into finding solutions? So Richelle, without further ado, I'm going to pass it on to you to sort of introduce the panel, and I will now flip my seat back into a hot seat actually and be part of the panel, and I'll let you host.
Thanks very much, Indu. So it's fun to be flipping the chairs. Indu is a great advocate for us in the PD community, so I really appreciate you inviting myself and the panel here, and to PMD Alliance for hosting it for us, this second PD Avengers Women and PD webinar for Parkinson's Awareness Month. And I'm absolutely blown away by the numbers, 165 women. I think this is the biggest webinar I've been on for women. And it's been really interesting. Myself, Kat Hill is one of the panelists, and another friend, Shri, who we all met at the World Parkinson's Congress, co-founded recently an initiative called the Women's Parkinson's Project, basically to do exactly as Indu said, to raise the voices of women with PD. And we're absolutely just blown away by the amount of colleagues and friends and women, both with PD and outside, don't have PD, who have contacted us and said, this is really needed. And I think the numbers here are basically showing that as well. So, really what we want to do out of tonight's webinar is to kind of have a call to arms of women around the world with Parkinson's to improve the treatment and hopefully, look at research that benefits not just women, but men also with Parkinson's disease. So I'm just going to share a presentation to kind of kick off, and then we're going to go to the panel sort of discussion, and we will have questions throughout as well. So just going to start here. Can you see that okay? Yeah, okay. So basically, I'm just going to get rid of myself there. So this, as I say, is Women with Parkinson's, the Hormonal Impact. So I'm just going to introduce the panel tonight. So obviously you all know Indu very well, but she is a movement disorder specialist in the Parkinson's Disease Research Education Clinical Center in Los Angeles, and also works in UCLA Health. She is boarded on integrative medicine and is an expert in mindfulness and yoga. We also have Roberta, I have to get this wrong, Marongiu, who is a assistant professor of neuroscience and neurological surgery from the Weill Cornell Medicine. We have Dr. Maria De Leon, who's a retired movement disorder specialist, who many of you know, and I bought her book when I was diagnosed myself with young onset Parkinson's disease at the age of 47. And we have a good colleague and friend since I met her through the World Parkinson's Congress in Kyoto, is Kat Hill, who's a retired nurse, midwife and nurse practitioner, an advocate for the World Parkinson's Congress. She's a PD Avenger and, as I say, a co-founder with the Women's Parkinson's Project with myself. I'm actually a registered dietitian, and I'm also a WPC ambassador for WPC in Barcelona next year. Hopefully we will have a women's event and we'll all meet face to face. I'm a founding member of the PD Avengers as well. So just to kind of kick off, to give you a backdrop to why we decided to have this webinar, and I'm going to go through the Women's and Parkinson's survey that we did, the results, and then we're going to move to the panel discussion and hopefully have some insightful discussion and answer some of your questions. So just to kind of give you the backdrop to why we're here today, is that there is research to show that basically there are differences between men and women in terms of their symptoms. So from a motor point of view, a recent paper in 2019 showed that women tend to have more tremor, suffer from more pain, have more problems in terms of gastrointestinal dysfunction, and also visuospatial dysfunction versus men who have things like more cognitive dysfunction and drooling and freezing a gait and things like that. This image here is actually designed by a colleague, Johnny Atkinson, who is an A&E consultant who has Parkinson's, and he, highlighted the sort of differences using a Lego image. So you'll see here that from a non-motor symptom point of view, women suffer more from anxiety, depression, fatigue, loss of smell, and obviously as well, we have the added effect of medication around our menstrual cycle. So there was a bit of a discussion on Twitter amongst a number of us ladies with Parkinson's around our hormones, around our menstrual cycles, and also in Facebook, always hear women talking about the impact of their cycle on their symptoms, or whether they're perimenopausal or postmenopausal. So actually, this is an image, again, that was designed by a gentleman who has Parkinson's in the UK. And we were explaining how, pretty much it's 1 week out of every month that women's Parkinson's symptoms are worse. So we kind of came up with the slogan, 1 in 4, we deserve more. This actually led me then, I was thinking, we really need to do something for International Women's Day, where it was actually to choose to challenge the bias against women in various different areas. But obviously one of the areas is for women with Parkinson's disease, that really there is not enough research for women in terms of treatment and, trying to find ways to slow or stop progression. So I joined up with a lady called Dr. Maria Teresa Ferretti, who launched an initiative called the Women's Brain Project. I advise any of you to go onto their website. They do an awful lot of research into other conditions that are affected, neuro and brain conditions that women are affected by. So we did a webinar together, and as part of that, we did a survey. And so I'm going to bring you through now the survey results. So we asked certain questions around hormones in relation to Parkinson's for women. So the results showed that worsening of Parkinson's symptoms did occur around menstrual periods. So basically 74% of women with Parkinson's said that their symptoms were worse. So that is a pretty high figure. In terms of the motor symptoms that get worse in around their periods, bradykinesia and rigidity were the highest, followed by dystonia and dyskinesia. So it's really quite interesting that it seems to be the kind of rigid type symptoms that particularly get worse. In terms of non-motor symptoms, you'll see here, fatigue is the highest. Then we have depression, excessive sweating, insomnia, anxiety, apathy are the main symptoms. What's interesting, we did also a translation into Spanish, and in that, the results from women from a Spanish origin actually showed slightly different non-motor symptoms. So fatigue was high, apathy was high, insomnia was high, but some of the other ones weren't, and I don't know whether that's to do with location, where they live. So that's something maybe that's interesting as well, is also the effect of where we live on our symptoms. In terms of the timing of symptoms around the menstrual cycle, it was shown that really 6% of women found that their symptoms worsened in the week prior to their menstrual bleed. There were, however, though 50% of women who still had symptoms during the full weeks of bleeding, and a few actually after their menstrual cycle stopped. Also, in terms of perimenopause, we asked, did your symptoms fluctuate randomly during perimenopause? Because obviously your hormones are a bit all over the shop during perimenopause, and 64% said yes. Similarly, they said it was hard to control their symptoms during perimenopause as well. And in terms of postmenopause, we asked whether the symptoms were better, after one had gone through the menopause. And in the English-speaking survey, 60% said that it was about the same, and about sort of 18% said their symptoms were better. And in terms of the Spanish respondents, it was quite interesting that actually it was much worse. A higher percentage said that their symptoms were worse after menopause. And a fewer percentage said it was better. So again, I don't know what's going on there in terms of the difference between English speaking and Spanish. We didn't ask location of people. And then in terms of hormone replacement therapy, asked, did you get hormone replacement therapy. And so there was about 20% of the English speaking survey said yes, but actually again, the Spanish speaking survey, it was only about 5%. So again, I don't know whether that's just lack of access to HRT, or I don't know, but we need to find out more. And then we asked whether those people who had HRT, did it improve their symptoms? So basically about 43% said that yes, their Parkinson's symptoms were better on HRT. And in terms of timing of HRT, we asked whether they, got their HRT during perimenopause or after, and it was, quite a high percentage there. 76% said that it was during perimenopause. And the reason we asked that question is because there is some research to indicate that possibly the timing of HRT is important in terms of slowing progression of Parkinson's, and taking it during perimenopause perhaps might, but the evidence is equivocal. In other words, there's kind of conflicting evidence on that. So we need more research to find out, because this is huge for women if there's something that we can do to slow progression. So then the last interesting question we asked was about your neurologist engagement around the effect of hormones on your Parkinson's. So basically we asked whether your neurologist spoke to you about the impact of hormones on your symptoms, and the resounding answer was no. So 8% said no. We asked, did your neurologist adjust medication around your cycles? Again, a resounding 95% said no. Did your neurologist ever suggest HRT? Again, a resounding 98% said no. And did your neurologist discuss the effects of perimenopause or menopause on your Parkinson's? And again, a resounding 90% said no. So I think it, fairly highlights that the discussion needs to happen more with our neurologists. So I'm just going to stop there, and I'm going to just open to the panel in terms of, putting a few questions to start with. So if I was to ask all the panel, what was, the standout result from the survey for you, what would you pick? So I'm going to start with Maria, Dr. Maria De Leon. So for you, Maria, lovely to have you here. What do you feel is the standout result on the survey that you would focus on?
Thank you for having me here. I'm really excited to see so many women come together and to be part of this. Well, one of the things, of course, that I've noticed in my research and my last, since I've been dealing with women in Parkinson's for the last 15 years, is that there are obvious worsening of symptoms during the perimenopause, rather during menstrual cycle, and hormones do seem to play a role. And I think you're right that it proved that the more the non-motor symptoms, seem to get worsened during this time. But it was interesting to me, one with the Hispanic and the non-Hispanic. So, definitely there's something there that we need to look at. Is the language, is it access to, to diagnosis? And so we really need to know the stage and the age and so on. But also it was interesting, which kind of highlights the fact that we don't know exact mechanism of hormone role in prevention and neuroprotection and being able to address the symptoms, because a big portion of the participants of the survey said they really had no improvement with hormone replacement or worsen. So, even though there was a slight increase, we don't know how significant it was, a small, number of participants in relation to, what we really like to see in a large study. So I think that's important. But to highlight this, something that I'm very, very excited about, and I think the Rao is on the one of the participants there in the audience today, is that I am working with the Cleveland Clinic in trying to figure out exactly that. We are working on trying to see if there's any genetic differences between women and men with Parkinson's. And we're kind of piggybacking to the PD generation survey that we're doing to try to find out, different genetic information. But I'm working with Dr. Mata's clinic, Rao and Ignacio and myself. We're putting together a specific survey to go along with that for women that will hopefully answer this questions. Is there a timing specific for hormones? When are the hormones changing? Because we know that hormones you have a direct role in the brain with the pituitary, but then you also have indirect, and the brain has a lot of cycles, interconnections, and a lot of feedback loops. So, increasing one thing may be, decreasing another. We know that hormones can play a role in changing dopamine and serotonin. And so we really need to kind of understand the pathophysiology first and try to understand the disease. We know that another neurological diseases like epilepsy and migraines, hormones play a big role along with Alzheimer's and other things. But when you give the hormones, it's important. So, trying to decipher that. So I don't think there was really anything new with this survey, other than interested in the response of the language, and also, again, whether, there's really, there's something else going on with the hormones as far as the timing, because again, there was not really a big difference with hormones versus non-hormones in the symptoms. So sorry, I went a long way about that.
No, that's really fascinating. Thank you. And Roberta, did anything stand out for you?
Well, I actually, Maria just took the words from me.
I'm sorry.
Yeah, actually, I mean, as all the panel knows, the focus of my research is understanding the role of menopause. But as Maria said, there are maybe many or several intrinsic genetic factors that can also make a difference between men and women. It's not all about hormones, although again, my research passion is to understand the role of hormones, but we should not forget that even before and after menopause, women still have a lower risk to develop Parkinson. So regardless of the menopause, regardless of the hormonal component, the risk is still lower, so there must be a genetic component. So that's the one thing that I want to highlight. That could be linked with different motor and non-motor symptoms as well. The timing issue that Maria also mentioned, I think it's important, and it could maybe confound the results of the survey or different studies, because when usually we do this kind of studies, we just pull together data from all women, regardless of whether they are pre, peri, or postmenopausal. So it's so far, the data is not clear on whether there is a timing component, like when is the right moment to give hormonal replacement therapy. And that's why maybe sometimes it works and sometimes it doesn't work. If it's maybe the treatment is taken too far along into postmenopause, it may not work. It may even be aversive. Or whereas if you take it maybe early during perimenopause, it may be beneficial to the brain. So there are different things that sometimes are not studied in the most appropriate way. And it's not because scientists don't do a good job. It's just, it's very complicated. It's very complicated to enroll, people with Parkinson's, patients in general. It's really difficult to enroll the right number of people necessary for the study to succeed. It's difficult to track different ages of menopause. I mean, I don't want to make it too long, but it's not that scientists don't do a good job. It's just a very complicated issue to study. That's what I want to say.
If I was to kind of come in there, Roberta, in terms of the genetics, so what do we say in terms of, they would say the prevalence is like 60-40, let's say, men to women. But if you look at studies in Japan or in Taiwan, actually women, I think in Taiwan, a recent study came out to show the prevalence is higher. So, what's going on there? Is that a genetic thing, or is it because women just aren't being picked up because, so I don't, Maria looks like she wants to answer that question.
Yeah, well, I think
it could be environmental, right, Maria? Could be an environmental
I think
component
that
too.
One is an environmental problem, because there are definitely pockets, all over the world where there's more women than men. And I think that's where we go back to this, getting a good epidemiological study. But I think that this genetic study is really going to help us to figure out who's at risk and try to give more information, because we really, although all the studies and we as neurologists have been told, men are more frequently, likely to get Parkinson's, but all the studies have been mostly with men, white men in large research, so we really don't know that is the truth. And it might have been that maybe that was the truth 20, 30 years ago, but with the new, changes I've seen, just in general, not anything scientifically based, but just observational, that there's increased risk, or rather prevalence, in young women with Parkinson's. So again, are there toxins? Are there something hormone, growth that we're adding to the food that is causing us, to age prematurely and develop? So there's still lots of questions to be asked. So we really, this is why this is great, because we need to start getting some answers, start posing the right questions so that we can move forward and perhaps then also help our, our male counterparts, what is going on. In regards to the study, the survey that you did with motor versus non-motor. Also, we know that as women, when we have menstrual cycles, we tend to have a lot of what we call negative symptoms, a lot of depression, a lot of fatigue, a lot of concentration problems. So those are already part of the hormonal cycle. So how much of that is really Parkinson's? How much of that is really just a synergistic effect? So that's kind of what we need to find out. Is there really a synergistic effect, or we're just seeing the hormonal, so we know that with any underlying, once we have Parkinson's as an underlying disease, any other illness that comes about seems to be exaggerated, right? I mean, it takes longer to get over a cold, it takes longer to heal, so are we just seeing more, accentuation of the regular menstrual cycle symptoms because we have Parkinson's? So that's kind of what we're trying to figure out.
Okay. And Indu, what about yourself? What sort of stood out for you in terms of the survey? So you're just muted there yourself there. You're so used to not being muted.
Sorry, yes, exactly. I'm trying to decrease ambient noise here, but before I go there, I'm just manning the chat a little bit, and I know that there's men on the call as well, and we haven't quite shouted out to them yet. And thank you for joining, and absolutely stay. You're part of the dialogue, you're part of the solution, you are part of, and it will help you to understand, what's going on in women too. I think, this type of research, these genetics, this sort of profile, the hormonal influence are going to impact everyone across the board, with this disease, if we can understand why certain things are protective. So please stay and be part of the dialogue, and you're more than welcome. So just to take a different tact, I think I'm a bit surprised about, and sort of not surprised about the fact that neurologists aren't asking about this, and I will own part of that. And I think some of that is, it has to change from an education perspective. We need to be, increasing disease awareness. One of the issues with understanding numbers of people around the world is, I think a lot of patients go undiagnosed because you don't even realize that women who are young can get Parkinson's, and they're told, that it's all in their head, or that the diagnosis is delayed. I think many of the women present later, in stage because of that. And so I think that's one thing. And the second thing is, I think we just need to be educating neurologists, globally, about caring about gender and race and all of these things from a diversity standpoint, so that we really are inclusive, in thinking about all of these things as contributors to how people are doing and the quality of life and things like that. And I think the other problem is that a lot of the things that have been mentioned, some of the symptoms are, quiet, sort of hidden under the surface. It's not just tremor. These are things sometimes that are in the non-motor realm, sometimes in even the mental health realm, that, women may not come forward and discuss. And if people aren't noticing these things, they're just assumed to be part of just, something that doesn't matter. So I think we need to be having more women come forward as a voice, educating, and as there's more doctors in Parkinson's that look like me, and we're attracting more younger women to care about neurology, the brain, movement disorders, hopefully we'll see, sort of more of a highlight of this. But I think we have to raise awareness and be strong voices. And with the research that's happening, there's a lot of research that's starting, I think, getting collaborative, standardizing protocols, standardizing questionnaires, so we can really gather the information worldwide from all the patients, is really important as well.
Yeah. Well, I suppose just, in terms of the, lack of knowledge and, and I know we sort of mentioned about, well, maybe, is it just the hormones because of, our going through perimenopause? But I think, to be honest, regardless of whether it's just a kind of an add-on effect or not, the reality is that women with Parkinson's are having a double whammy, and that we need to do something. So it's either, as neurologists, need to say, well, we need to refer you to a gynecologist who understands hormones to get you medication to help with that, so that it makes your PD symptoms, better. Or maybe it is that we need to tweak your medication, to help your symptoms. In our last webinar, there's a clinical nurse specialist, and she particularly picked out in the survey what she was concerned about actually was the motor symptoms, because she said young women who are working, have family, that like if their, motor symptoms are going off, it makes it much harder for them to actually, do what they want to do. So I thought that was really interesting, obviously, from her engagement with people in her clinic. So Kat, that brings me on to you, obviously, as someone who lives as well with Parkinson's, and also, being a nurse, retired nurse and midwife. What stood out for you, and what would you like to see happen?
Well, I think first and foremost, I'm with Indu that I'd like to see more discussion happening in the clinic. And I don't think neurologists are unique to this. I think anybody that doesn't deal with women in periods like nurse practitioners and midwives do, it's not a comfort level for a lot of people, and a lot of providers are not unique to that. And I think I would like to see women engage with their providers and talk about the issues that are happening. Share if you're not feeling well, or if you feel like your medicine isn't working the week before your period, or you're having perimenopausal symptoms and you're not sure, is that because of the Parkinson's or is it because of menopause? I think we need to partner with our providers and have the discussions so that we get some help with it, and also bring it to the forefront of their practice. I think we need to work from both sides, both the patient standpoint and the provider standpoint. So I was not surprised by the numbers, although I see there's real opportunity for growth and change. And I think I'm excited that we're having the dialogues around it. I'd also like to say that I believe in science, and I think we need trials, but also maybe there are some things that we can be doing before we try trials to maybe help women mitigate some of their symptoms. And I'd love for us to think outside of the box and start having dialogues around what might be helpful for women. Can we adjust dosing? Can we change what we're doing in the clinical setting if patients really aren't getting relief the week before their periods, or perimenopausally? So that's my 2 cents.
And actually on that, so if I kind of, ask you, Maria, in your time working as MDS, I don't know whether you dealt with women with Parkinson's in terms of, on our last webinar, there was a discussion about, well, do you, help women by, using hormone therapy, or do you increase their levodopa, or just, so Elena DeMauro mentioned that maybe, for dyskinesias that you might actually, use more of an agonist and less of a levodopa. Because obviously there's issues in terms of absorption in women is greater of levodopa than it is of men. So would you have any view, Maria, in terms of, is it a combination of both, that you might look at hormone, like some people get put on the pill? So the gynecologist who was on, who also has Parkinson's, on the last webinar said that in some cases people take the pill and that helps. So have you any view on that, Maria, in terms of, what we can do, as Kat says, now to maybe help women with their symptoms?
Yeah, I think, there's definitely things that we can do to manage the symptoms. Of course, again, it's not a straightforward answer. One, because I just saw a recent study that hormone replacement, again, depending on the mechanism of action, can have more or less, benefit or neuroprotection. So, that's part of the study, what we're doing, trying to look at what mechanism of action, not just when it was given, but how it was given. Is it a yearly, a monthly, pill, a patch? That makes a difference. And of course, you have to look at the whole person. Not always, if the person also has risk for, migraines and other things that may put them at risk for stress, you don't want to, necessarily give them, hormone replacement or pills that may increase that risk, so you have to really think about the whole person. But one thing that I did do when I was practicing, and I certainly did as a patient, was that, just as I treated catamenial headaches and seizures and things, looking at that period of, 3 to 5 days before the period and, during the menstrual cycle, increasing the levodopa really has a positive effect. Increasing, not dramatically, but just, one extra dose, perhaps, mild dose during that time, just for that specific time, really help patients, be able to function better and not feel the effects. And that worked for me as well. But that doesn't always work for everybody, because, what I find also is that, as it happened to me, is that sometimes the Parkinson's medications can alter your cycle as well. And so not only is your cycle now, shifted, so it may be more, it'd be longer or more severe. So then, of course, you're dealing with that and dealing with, the effects that brings on. So you certainly, going back to what Kat and Indu said, having that conversation. And I wish that neurologists would start treating Parkinson's and other chronic diseases as a whole, because what happens, and that's the way I treated my patients, addressing all the symptoms that went around, whether it was their blood pressure, whether it was their hormones, because what happens a lot of times when you send them to another specialist, they may not understand the Parkinson's aspect, they may not understand, so then you get fragmentation. So, we need to, if we're going to treat a chronic illness that is systemic, then we as neurologists need to be trained and treated, learning to recognize these things and knowing when to interact, when to, ask the questions and what to do. So I think that you can treat it. Like I said, I think that we should start treating it, perhaps, but also addressing what are the other things. Sometimes we may have to do hysterectomies or other things to improve the symptoms.
And I suppose, Indu, do you agree? It sounds like low-hanging fruit, really, in terms of potentially trialing an increase of levodopa. How, and obviously, as they say about Parkinson's, you meet one person with Parkinson's, you meet one person with Parkinson's. So you need to treat women individually as well. But surely it's worth even that to say, and it was interesting in the survey that basically there was like 90% of neurologists did not change levodopa treatment around. So do you think that is something? Have you come across it into yourself with patients or?
Yeah. Well, getting back to it, I think Maria was saying, I think, anytime you have something else systemically going on, so if it's the flu, if it's a urinary tract infection, even if you're horribly constipated, or if you have a major stressor in your life, like somebody, passed away and you're in grief or whatever, I think, and even with COVID, I think sometimes we're seeing, this exacerbation rate, sometimes even transiently with the vaccine a little bit, people are feeling a little bit exacerbated. I think similarly, any fluctuation maybe that's subtle, that could be hormonal, especially in that 5 days, could definitely worsen things. And I think, I know on the last seminar, you had also talked about not just maybe manipulating medications, but considering other, is there a mind-body approach, like maybe, taking a little extra sleep maybe, or, giving yourself a little extra time to get ready that day and maybe, getting a yoga session in or building in some self-care at that time, like many people do who have migraine, many people do who have, other disorders that are affected by the menstrual cycle. I think know that is the hardest time of their month, that this is a valid thing to, maybe, pad in a little bit of extra, maybe a day off here or there, or some, modified work schedule, or if there's some way to, kind of treat yourself a bit nicer. I think that is something that I think should be reasonable. In terms of taking an extra dose of levodopa, there are sometimes even these newer kind of as needed therapies with the inhaler and some other things. So maybe some people need an extra dose. But I think one of the first things, and you brought this up on the last call too, is to sort of get a sense of a motor diary if you can. And, the motor diaries, of course, are motor diaries. So they're, stiffness, slowness, tremor, things like that we're sort of thinking about those off periods. So what a motor diary is, just real quick, is, you basically break down the 24-hour cycle in half an hour's time slots. This is it started with Dr. Hauser, who came up with this around clinical trials, especially for medications, and they've been around for a long time. time. So each time slot you have either you're on, so your medicine's working well, on with dyskinesia, on with troublesome dyskinesia. So you have these, times that you may have extra movement, you rate that off. And when we talk about off, usually we're talking about those off symptoms that are motor stiffness, slowness, tremor, but maybe we start thinking a little bit more outside the box of, what's your non-motor off? Maybe people feel a bit spacey, maybe they get fatigued, maybe they have other things that are, maybe depressed or anxious, when they're sort of, so I think we have to expand that sort of off time frame, and you just get a sense maybe of a few days throughout the month. You do this motor diary and maybe non-motor diary. You can circle when you took the pills, and I think if we can get a sense by women in general as they're going through perhaps menopause, perhaps, changing, maybe if they go on hormone replacement therapy or if they're on the birth control pill, they get a sense of these things. We can add some way to track what part of the cycle they're on. So you have to modify this because the normal Hauser diary just, is sort of just a day-to-day thing, not looking at other variables. Hopefully we can get a better sense of this and then feel a little bit more free to, say, yeah, maybe if 8 p.m. on, 5 days before your period, every night you feel not so well. Just looking at the chat, it sounds like some people are feeling evenings sometimes as their worst. Maybe add a little extra something there, or, maybe do a breathing exercise or something different, or go to bed an hour early. Maybe I think you could sort of have a sense of, one intervention that you might do, track that then for the next few months and see if it makes a difference. I agree. I think huge trials in populations and waiting for that data before we make any changes in all women is going to be, 10 years down the road, right? So we have to get a sense anecdotally. And I think a lot of people are writing things in the chat as we're speaking about how many of these things are resonating. And I think we're up to 190 people. So I think, you have a lot of participants here just to survey in general. So
yeah. And I mean, I think just picking up on your sort of, integrative approach. In fact, I was just reading there recently that in terms of yoga, actually therapy seems to be beneficial for menopause itself. So, and obviously there are some trials that show yoga helps Parkinson. So maybe there is something there. But I suppose just on the trial sort of question, if I bring Roberta in, in terms of the last webinar, again, was talked about that we need to have more randomized controlled trials. We need to prove that, that there is a problem. So Roberta, has done some research on Parkinson's in women around the menopause. She just recently won a $270,000 grant to look at menopause and Alzheimer's. But I believe, Roberta, you're having a bit of a problem getting people to believe that we have problems with Parkinson's in the female population. So would you maybe share a bit about your experience around that?
The focus of my research is to understand the role of specifically perimenopause in neurodegeneration, and I'm studying Parkinson's and Alzheimer's. So when I submitted my grant on Alzheimer's, the people that review my grant truly believe that menopause is a factor, a risk factor for Alzheimer's. It's also true that more women than men have Alzheimer's, whereas with Parkinson is the opposite. So it's been a little bit challenging to convince the people that are reviewing my grant that actually menopause and hormones are a big component and increase the risk of Parkinson's, or can increase, as we said, motor and non-motor symptoms in some women. And I think, as I mentioned before, the fact that there are conflicting studies, that there is not a clear answer whether hormones have a role, or that hormonal replacement therapy can be actually beneficial or not. It's been going against my funding, my hypothesis, let's put it that way. I do believe that menopause, specifically the menopause transition time, really influences the risk and the development of Parkinson's. So it's just a matter of figuring out the right way to convince the reviewers that this is worth funding, this is worth understanding. And it's not just for women, but it's also for men. Because if we do understand molecularly, mechanistically, what is happening, what is the difference, what's happening in women that is not happening in men, or the other way around, that can help both it's not just about women. It's about everybody that has Parkinson that can really benefit from studies of this kind. So
yeah. So I think, you know, it's a bit of a call to arms, ladies out there, that we've hit almost 200, that we need to, you know, be really advocating for more research in this area. I think one of the benefits of the Alzheimer's community is it's very strong in its advocacy, and has very strong people like, I think the Kennedys, what's the lady, sorry, her name?
Shriver.
Yes, Maria Shriver is a big, you know, proponent of research into Alzheimer's. So I think we need a few big heavy hitters behind us. I've seen a couple of comments with regard to early onset menopause. And I know in terms of the research, it's shown that there is some research that shows that early onset menopause might increase the risk of developing Alzheimer's and Parkinson's, and that getting HRT before the age of 51 actually helps to reduce that. Is that the case, Roberta?
Yes, it's not fully clear again, as I said. There is an indication, there are several studies that show that early menopause increases the risk of Parkinson's, and that there is a correlation between age of menopause and age of diagnosis for Parkinson's disease. To put it in, you know, as an example, there could be 10 studies and 7 or 6 out of 10 go in one direction and the other 3 or 4 go in another direction. That's where the challenge has been. But again, it's challenging for the doctors and the scientists that put together these studies to have, as Indu said, have standard protocols. It comes down to that. It comes down to the fact that every study has a different protocol. Every study enrolls women in a different way, that they have different demographics, different symptoms. And so when you try to pull together data from different studies, it's really hard to combine them. It's really hard to compare.
Yeah.
So,
and just in terms of, there's a lot of people here commenting about, you know, what is the relationship between the timing of menopause and Parkinson's? So, you know, if you have a later menopause, you know, if you have more risk of Parkinson's. Kat, would you have any, you know, in terms of, I'm sure I've heard that basically, you know, women who've had more children and who've had a longer sort of, you know, hormonal life, I suppose, in terms of cycles, tend to have a lower risk of Parkinson's, or it appears later in life.
Yeah, I don't have that data at my ready, but I think that as we move towards more individualized medicine in general, like we're all saying, we're not here just to help women, but I think we need to look at the big picture all the way around. And does estrogen play a neuroprotective effect, or does it not? And that would be the same idea. Is unopposed estrogen a risk factor, or is it not a risk factor? And that would have to do with a patient's, you know, bearing children and being pregnant, and then the role of birth control also, I think, can be significant. So I think I love that we're having the dialogue, that we're asking a lot of questions, and I think that everybody out there that's listening needs to be asking questions of their providers. And I also think that we need to be thinking more holistically all the way along the line. You know, those of us that have comorbidities, other diagnoses that predated our Parkinson's, you know, if it was a mental health, anxiety or depression, is that really Parkinson's manifesting early? Is it not manifesting early? Is it hormonally related? The fact is, we just don't know enough. We just don't know enough, and we've got to find out more, and we need to be we need to show up, we need to ask the questions, we need to be part of the conversation, we need to help get funding for these issues. And I think it's really critical that we're all here today. So I'm frankly pretty excited about the whole thing, even though Parkinson's is not my favorite thing, but I sure love the people I keep company with since being diagnosed.
Just to bring up a very important point, Kat, it came up in the last webinar as well about precision medicine. And it was quite interesting in terms of, there was a study done by Malu Tanzi, who is a researcher. And in a paper that she did, it actually showed that gut inflammation was different between men and women. And there seemed to be a higher presentation of colitis within men or within women. So I suppose in terms of, you know, looking at that, and also prodromal symptoms seem to be different between men and women when they sort of, what it is that they start with. So I agree with you. I think we need to start looking for biomarkers that are possibly, different between us. And ultimately, we all want to find some way to halt the disease to start with, slow the progression, and find a cure. So whatever we can do to do that. So in terms of
that's our short list, Richelle.
Not much to ask, is it? So in terms of just, again, there's more women who are diagnosed with Parkinson's post-menopausal, so after the menopause. So back to your point, Roberta, that they want evidence. How much more evidence do you need than the fact that obviously, so in terms of heart disease research, the penny dropped somewhere along the way that they realized that women's risk of heart disease is the same as men post-menopausal. And so they started to focus on women's heart disease because women just weren't complaining of it because they're not complainers. And so they were presenting in A&E with sort of, pains and a bit of stress, but actually, they were having a heart attack. So in terms of like, what more do we need to show that, there is an indication very much that hormonal risk is a part of Parkinson's and needs to be addressed?
Well, maybe you asked the wrong person because I don't need any more proof.
So,
I'm convinced. As I said, that I like the current available data is conflicting, but it's also some older data when we didn't know how to look at it. There are retrospective studies, and again, and we mentioned also that different populations may have different outcomes, and also these studies are performed, the data is collected from different populations. So I don't think we need much more. I believe that we are ready to study and to understand it. How to convince policymakers and how to convince funding agencies to fund it, that's something I'm still trying to figure out. I'm fighting.
So Maria, what do you think?
Any suggestion?
Yeah, so Maria, what do you think? You've been a campaigner from the early days. So what do we need to do to galvanize?
What we're doing, I mean, we just have to keep doing what we're doing. But two things we as women can do to help, there's a study by the CamCare PD. I'm sure you guys know Lori Mishler. I'll be glad to send that email so that, people that haven't participated, she, along with the Cleveland Clinic that we're working on, we started collaborating so that they are now including more women issue topics, just like we're discussing about hormones, hormone replacement, menopause, so that we can have some preliminary data. So Roberta, that's something that she's been doing this study for, I've been participating in it for at least 5 years that I remember. So so that's something that, you can get some preliminary data, but also the study that I was talking about with the genetic study with the Cleveland Clinic and the PD Gene and Rao, we have a survey and we're going to be passing it out. So we'll be sending it to you soon so that we can start getting some preliminary data. Of course, that does not include the genetic aspect, but getting some preliminary data, how women are affected. And I think that would serve to sort of support this idea that women have not only different needs and have hormonal issues that are not present in men, but why we need to study it. And so I think that that's something that we can continue to do. But just what everybody's doing now, just keeping track of everything, going back to the diary. Sometimes when you have Parkinson's, it's hard to write, and it's hard to write those diaries. So I find that maybe a video diary is just as useful, is just as good. So just write like 5 seconds, 10 a minute, and that really will help you track your symptoms. And I also find that sometimes when you do that, things that you never thought of that were an issue, when you see yourself and when you're doing, you're like, oh, I'm having this problem. So I think that's very useful.
Yeah.
Richelle, may I just add?
Yeah, sorry, yeah. Yeah.
So I hope I'm not giving the impression that nobody wants to fund this type of research, which is not true. Okay, I'm just saying it's more challenging than for other type of research, because I have to, for instance, thank the APDA. They gave me a small grant, which recently ended. And with that funding, I was able to actually, in the laboratory, prove the perimenopause as a role in Parkinson's, okay? So I'm using this data to convince NIH at this point, but it's not like all the funding agencies don't believe in this, that nobody wants to fund this type of research. It will come. I think it takes an extra push respect to other type of studies. So
well, I think anytime you're doing something different, it's going to take a lot. Once upon a time the earth was flat, and nobody believed otherwise. So you have to go against the norm. So trying to prove that there is something that needs to be studying, or something different that nobody's thought of, or thought it was important, it takes some doing. But I think that 15 years I've been doing this, and we're finally, seeing a little bit momentum, and I think it's gaining a lot of momentum. And I think this is definitely the right time to be pushing for this kind of research grants and studies. So.
Well, I think, it's a very important point that, advocates, we with Parkinson's and our family members, and that can actually, help to push that agenda by actually bringing up the conversation with your neurologist and saying, I am suffering, I need you to find a way to solve this for me, because it's only by, and I know from doing a lot of advocating as a registered dietitian for chronic diseases, other diseases. I was the president of my professional body here in Ireland, and we did a lot of advocacy work, and it's only when the patients start complaining that people sit up and start listening. So we have to put the pressure on from the bottom, and then we have to get, people to kind of put pressure on from the top down. And that's in terms of, the Movement Disorder Society. It's also Elena Mora, who is very high up in the European Academy of Neurology, has set up a sort of subgroup looking at gender in neurological conditions. So this is where we need to influence as well. We need women speakers at these events, talking about the gender differences. I think that's a really important point. In terms of Kat, going back to Maria's point around surveys, you are on a committee with the WPC. You might share a little bit about the survey that you're doing there as well.
Yeah, and so is Maria. So we're working there's a subgroup for the planning committee for the World Parkinson Congress in 2022 in Barcelona that is looking at a survey specifically around young onset Parkinson's, but the subset of us are really working on the women's portion of that and how we're going to ask questions and what we should be looking at in terms of data collection. And that survey will be translated into multiple languages, and we're hoping to launch it at the World Parkinson Congress in 2022. And just because somebody isn't young onset doesn't mean that they can't contribute. I've seen in some of the thread, there's lots that we can be doing in terms of answering surveys, volunteering for research, having more women represented in research in general. I think is a way that we can contribute. So if you can't get your hands on a survey, there will be a lot out there. And I like the term, even though I say people will say complain, I think we just need to be honest. And some of us don't. I'm so uncomfortable with that word complain, and many women are, but we need to speak up for ourselves. If you don't feel good, share that you don't feel good and work on getting solutions. And it's not complaining if you're reaching out for help, right, ladies? We can reach out and advocate for ourselves and be heard. And if we don't like the answers we're getting, let's change who we're asking or how we're asking, and reach out to groups. Yeah, Indu.
No. I just was going to say something, but Richelle, you're the moderator. So whatever.
I was just going to say, just in terms of, back to Maria's point and Indu around, monitoring. I think what makes it easier sometimes to complain is to actually have a little diary to bring with you. So, I think a video one, Kathy Molahan, who is a WPC ambassador on the last webinar, mentioned the same thing, that, and there is this kind of white coat syndrome, when people go into their doctor, they seem fine, and then they go home and they're all over the shop because, the kids are screaming, whatever's going on stresses them out, and their symptoms are, all over the shop. So we have to be really honest, or honest but if you have that information, it makes it easier to have the conversation, because even women sometimes feel uncomfortable talking about hormones and things like that, as well, and menstrual cycles, but it's really important. I just want to touch on, there are a few women who mentioned about sort of pregnancy, or things like IVF therapy sort of set off their symptoms. And I myself was diagnosed when I was pregnant with my second child. Well, actually, I picked it up myself. As a dietitian, I noticed that my handwriting in my dietetic clinic was was very small when a patient came back to see me after many years. And that was my initial symptom. But I know a lot of people through some of the Facebook groups have mentioned that their Parkinson's has come on around pregnancy. So I don't know if anyone here on the panel has a view on that, what might be going on around that. Or again, IVF treatment, I've been through it myself as well, whether that, you know, is a risk factor in terms of, you know, being pumped with loads of different hormones. You know, I know that's a bit of a left of field, but does anyone have any view on that for, you know, some of the comments women have made about pregnancy? And
I think it's similar to what we've said, any additional stressor, physiologic stressor on the body, right? So with if you have a cold, if you're having your period, if you're pregnant, that's a physiologic stressor. It may indeed exacerbate symptoms. Although I'm going to just say again, we don't have super great data around this with Parkinson's, but let's change that and let's learn more about it. But I think it's not a reason to say don't have children, but it's something to go into with your eyes wide open if you're considering a pregnancy with Parkinson's.
And actually on that point, and Leanne, who was the gynecologist on the last webinar, mentioned that she's going to do applying basically to do a research study to get a register of pregnant women with Parkinson's around the world. So again, we'll share that information with people when it comes out. So I think it goes back to, we need more information for younger women with Parkinson's, their menstrual cycles, with women who are perimenopause, with women who develop it menopausally. We need to look at the whole 9 yards. You know, we can't forget the women who are diagnosed, you know, postmenopausal in terms of, well, what can be done there as well. And so we're all going to end up there, you know, soon. So I'm just conscious we're like coming 2 minutes to sort of end the time, and I hope we've sort of covered some of the questions that are in the chat there. There's so many. So just a couple of things I want to say is just a shout out to maybe some of you to sign up to the pdavengers.com, and we will keep you informed of any, you know, surveys that are coming out, any research that's happening, any kind of calls to action around women in PD. Would be great if you could do that. The survey is still open for women if they want to, and if we can encourage the Latino Spanish speaking community also to do more, because I think that's actually quite interesting why there's the differences there. We haven't touched on socioeconomic reasons, you know, behind the differences. So you'll find that on the PD Avengers Facebook page, and we'll put the links up on the PMD Alliance as well. And I think as well, you know, looking at the chat, there's lots of women out there. There's Twitchy Woman, there's Kathleen Kiddo, there's, you know, Maria. You know, I think we just need to basically, you know, be amplifying each of, you know, together, working together to amplify the voices of women with Parkinson's, to basically to the betterment of everyone with PD. So I just don't know if anyone has I think in terms of a call to arms from this webinar, it very much seems that we need to galvanize the women's voices. We need to actually, you know, we're going to put a paper together out of these 2 webinars. And I think from this one, it's going to be about looking for research, you know, funding for women's and Parkinson's. I think the other thing is very much about tracking in terms of diaries, you know, using video diaries. And also maybe we can put something together that is, you know, some kind of a template that women can bring in to discuss with the neurologists, you know, some kind of, you know, call to action for the neurologists and to help them manage themselves. So hopefully you'll have all got some answers. And if anyone wants to say, Maria, anyone wants to say a last thing before we go?
Well, I wanted to say again, thank you. This was great. We definitely need more of this, and thank you for all the women that joined. But I wanted to tell everybody, remind everybody that self-advocacy and, you know, listening to your own body, knowing that you have issues and finding the right answers, you know, even though, you know, you may get a lot of nays initially, or say, you know, you need psychiatric help or some other, you know, continue searching for those answers, advocating. It is not complaining if you know there's something wrong. And we have the Parkinson's diva. That's why part of why I wrote that, because if I can't talk about those issues that sometimes are embarrassing or, you know, salient, that, you know, as a physician, as a woman, then, you know, how can we as patients do that? So you have that template, and a Diva 2 should be coming out soon. So hopefully, you know, this will continue, you know, to help and motivate everybody to self-advocate and, you know, and find the answers you need to get better.
Thanks a million, Maria. So I'll pass over to Indu to maybe round off, and thank you to all the panelists and all the fabulous women who turned up tonight. I hope we have a screenshot to show the numbers.
Well, we'll have the recording, and we will post lots of information and link anyone who's doing a survey. We can try to link with this. I think it's really important that everyone collaborate, because I think everyone doing their own little thing all over is going to make it harder for us to really get the numbers that we need to then prove that we need to be doing this on a higher level. So definitely important for us all to be, thinking about things a little bit more broadly and collaborative. The other thing that I would say is just manning the chat here. It looks like there's a lot of women that are feeling a bit isolated and lonely, and you're not alone. You can see just with the group that's here, we had 190 people here. There's a lot of women's support groups out there. Social connection is huge, and not feeling like you're the only person suffering alone, because we are, women in the minority. And so I think having other women to, validate, having chats with other women, having a tribe, having girlfriends that can kind of come into the appointment with you can definitely help. So, get connected. I think that's the main thing. As women, we tend to be sometimes the quiet voice. And so, having other women to help, lift up your voice and amplify it is important. Thank you so much for joining us for this event. Annalene will be coming on, actually, who's an OBGYN in the next month. I think that's linked here too. So we will continue to have these conversations, and thank you so much for joining us today. I appreciate it. Andrea, I'll hand it back to you for a goodbye wave.
Well, talk about staying connected and sharing our voices. We always like to show our gratitude for our panelists with a goodbye wave. So if you've had your video off, I invite you to turn it on, put it on gallery view, and I just love to scroll through and see everyone showing their gratitude with a goodbye wave, all of our faces and our smiles and our energy across the world today. So thank you for joining. Thank you for your excellent questions. Thank you to all the panelists who shared your time. And this is just the beginning. We will have more conversations and can't wait to be a part of all of them.
Thanks very much, Andrea, for facilitating it for us, and Indu. Thanks to the panelists.
Bye.
Thanks, everyone.
Bye. Thank you so much. Bye-bye.